Okay, hi, how are you? Nice to meet you.
Good, how are you?
Good. All right, you guys all set? Okay, great. All right, good afternoon, everyone. Welcome to our March 23rd, 2020 press briefing. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and I'm here today with my fellow commissioners, Commissioner Ken Lawrence and Commissioner Joe Gale, District Attorney Kevin Steele, Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Guam, our Regional EMS Director. And this is Megan joining us today. Thank you so much for being here with us. COVID-19 continues to be a rapidly evolving situation here in Montgomery County, and I have a number of updates for you today. As always, I will update you since our March 22nd press release, so yesterday afternoon's press release. Since that time, we have had 26 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 136 cases. We're going to begin presenting these cases in a new way today, given the number of them. So, and I want to remind everybody that we'll always have updated information on our hub website, montco.org/COVID-19. So these 26 new individuals are from 12 municipalities, 4 of which are reporting their first cases, and that includes Upper Gwynedd Township, Narberth Borough, Towamencin Township, and Lower Frederick Township. These individuals range in age from 18 years old to 81 years old. And I want to emphasize that given the increased amount of testing that has been available to people in Montgomery County over the last week, and this includes doctors and hospitals having access to commercial labs, as well as the community-based testing site that we set up last Friday, we fully anticipated seeing an increase in the number of individuals that tested positive for the coronavirus, just simply given that we are testing a lot more people. I want to give you a breakdown on the ages of these individuals. We had 1 person between the age of 10 and 19, 2 people between the age of 20 and 29, 4 people between the age of 30 and 39, 4 people between the ages of 40 and 49, 5 people between the ages of 50 and 59, 5 people between 60 and 69, 3 people between 70 and 79, and 2 between 80 and 89. 13 are female and 13 are male. 9 are being monitored at home. 4 are hospitalized, and 13 of the individuals we are still tracking down whether or not they are hospitalized or not. I want to give a quick update on our community-based testing site. I'm very pleased with how this has been going. The site has been up and running successfully since Friday. By the end of the day today, we anticipate testing approximately 1,100 people since Friday. And I just want to again thank Temple Ambler, Upper Dublin, and the Pennsylvania National Guard Medical Unit, as well as numerous Montgomery County departments that have been providing services and support at this site. They're doing an extraordinary job. They're out there today in this cold rain, and we all owe them a huge debt of gratitude. The site remains open by appointment to individuals meeting the criteria that I will review in a moment. The site is open from 10 a.m. to 6 p.m. daily as testing supplies allow. Individuals meeting 1 or more of the following 6 criteria will be eligible for testing. So we have broadened our testing criteria slightly today, and I'm going to go through those criteria right now. Anyone with a fever at or above 100.4 degrees Fahrenheit and with respiratory symptoms such as a cough or shortness of breath. Anyone with a temperature at or above 99.6 degrees Fahrenheit who is 65 years of age or older. Any first responder, law enforcement, fire, EMS, or dispatcher who is concerned that they were exposed to a patient with suspected COVID-19 or has respiratory symptoms, or a healthcare worker providing direct patient care and testing is not available through their employer, and they have concern for exposure to a patient with suspected COVID-19 or respiratory symptoms. Additionally, we're inviting people who have known or suspected direct contact to a person with COVID-19, as well as people whose doctor or healthcare provider has recommended that they be tested, but has not yet been able to get a test. If you fall into any of those categories, we would welcome you at our testing site. Online registration for testing appointments is available at www.montgomery.org/COVID-19. There's a button at the top of the page that says community testing. Just click on that button and follow the directions. That information is also available on our Montgomery County government social media accounts. Individuals who do not have access to the internet or don't have an email address can call 610-631-3000. That's 610-631-3000 between the hours of 8 a.m. and 8 p.m. to register for testing over the phone. If you call that phone number and the line is busy, just please wait 10 minutes or so and call back. We do occasionally get high volume on that line. Most importantly, please do not call 911 for testing appointments. We don't want to tie up the 911 line for testing. Due to the limited number of tests available, tests will be and continue to be reserved for the higher risk categories of individuals that I just described. Generally healthy individuals who have mild symptoms and no underlying medical conditions should remain at home and self-isolate. You do not need to be tested at this time. The criteria that we're using for testing may be enhanced or relaxed based on future availability of tests. I also want to announce that at 2 p.m. this afternoon, Governor Wolf announced a stay-at-home order for Montgomery County, along with Bucks, Chester, and Delaware County, beginning at 8 p.m. tonight for 2 weeks. I support this order and encourage the governor to issue this order. I believe that staying home, except for essential work or essential trips, is the most important thing that we can do as a county to slow the spread of COVID-19 and protect those most vulnerable to COVID-19. The elderly, those with serious underlying medical conditions, and those that are immunocompromised. Staying at home protects our first responders, our hospitals and healthcare workers, and other critical workforce from being overwhelmed by COVID-19. Staying at home is how, together, we will beat COVID-19. So let me give you a sense of what this stay-at-home order means. Generally speaking, those who should be, I'm going to do it this way. Those that can leave the home can do so for reasons that fall into one of 4 buckets. First, for health and safety. You can leave your home to engage in activities or perform tasks essential to your health and safety or to the health and safety of a family member, such as seeking emergency services, obtaining medical supplies or medications, or visiting a healthcare professional. You can leave your home for necessary supplies and services. For instance, to obtain necessary supplies such as groceries and food, household consumer products, and products necessary to maintain the safety, sanitation, and essential operation of a residence. You can leave your home for certain types of work, to perform work providing essential products and services at life-sustaining businesses or operations in keeping with the governor's order. And finally, to take care of others. You can leave your home to care for a family member, a friend, a pet in another household, or to transport family members, friends, or pets. And just a few examples of life-sustaining businesses, that includes stores that sell groceries and medicines, organizations that provide charitable and social services such as food pantries, religious entities, media, gasoline stations, financial and insurance institutions, hardware and supply stores, mail and package delivery services, laundry services, and restaurants to pick up food for consumption off-site. As you know, we have prohibited any dining in any restaurant. And with that, I'm going to turn over to the Chief Law Enforcement Officer in Montgomery County, District Attorney Kevin Steele, to talk about this new order and what enforcement might look like. District Attorney?
Thanks for having me. Good afternoon, everyone. Today, as you heard, we're entering a new phase in Montgomery County's fight against this pandemic. The stay-at-home order that's effective, I believe, 8 p.m. tonight is to protect everybody, young and old, by limiting the spread and flattening the curve. While we expect that the vast majority of Montgomery County residents and businesses will comply with the previous order and the new order, there may be some businesses that are deemed not life-sustaining businesses under the order that might consider staying open. My advice to you is don't do it. Comply with our legal order to close. Our local departments throughout Montgomery County are ready to enforce this order. Don't make them do it. If you violate, you can potentially face summary violation, $300 fine, or other penalties, like being charged with obstruction of the administration of justice or law or other government functions, which is a second-degree misdemeanor that could lead to jail time. Our law enforcement community is up to speed on this and they're ready to act, but we don't want to have to act. We all realize that closure of a business is difficult, but look, this is about health, safety, and the welfare of all of us. Police officers in every municipality in Montgomery County are working hard alongside all the EMS workers and other first responders to keep us safe. Let's not make them have to come out and deal with business owners in the communities. That's the last thing that they want to do or need to do. That's not where they should be spending their time. So let's get voluntary compliance on this order to stop the spread of coronavirus. So more broadly, our police departments and the district attorney's office are operational and are handling criminal cases as they come. Police are handling 911 calls. They're still on patrol. They're still helping people stay safe in their communities. Our Montgomery County Detective Bureau is handling all calls and moving along in ongoing investigations, including in the last week's homicide arrest in Cheltenham Township. And me and my staff in the district attorney's office are still handling criminal matters under new guidelines issued by the courts and continue to be operational in this new normal of life during this pandemic. But criminals should know that law enforcement and our law enforcement community in Montgomery County is still operating business as usual, so if you commit crimes, you'll be arrested for criminal behavior. Our first priority is to keep people in Montgomery County safe. So stay home, stay healthy, stay safe. We're all in this together, and we can get through it together. Thanks.
Thank you, District Attorney Steele. So I just want to emphasize to everyone the same messages that we've been giving you for the last 2 weeks. Everything that's happening right now is absolutely what we expected to see happen as we compared the trajectory in other communities with this virus to what we're now seeing here in Montgomery County. As we tested more people, we expected the number of positive tests to go up. We also expect, just in general, the number of positive tests to go up. The point of these mitigation strategies, the point of asking you to stay at home, is to continue to keep this curve as flat as we can so that we do not overwhelm our hospitals. We do not find ourselves in a situation like the people of Italy are finding themselves in, that we do not find ourselves in a situation that appears to be building in New York City, where there's just exponential rise of positive individuals in the city that could potentially overwhelm their hospitals. So this is the time to stay home. I think folks around this county have done an extraordinary job of doing that. I was really pleased this weekend as I was driving back and forth. I actually went to the grocery store to see very few people out, and that's exactly what we want to see. Think carefully, try to bundle an errand into one trip if you can, and just stay home, and it's going to be okay. We are going to get through this, but we will get through it more quickly if we all stay home and limit the spread of this virus. And with that, I'll be happy to take questions.
Do you have any clarification on that stay at home as far as, we talked last week about trails and like going out for a run or those type of things with the social distancing in place? Is that covered under this, or is that still?
So the question is, do we have clarification on whether or not it's okay to go out for a run or a walk, those sorts of things? So as of the time I walked into this room today, the governor had not yet posted the final order so that we could read it. I would urge that if that is a life-sustaining activity for you, which it is for many of us, that it's okay to go out and get some exercise and breathe some fresh air, but you must maintain social distancing. So you should not be going out in big groups. You should not go out with anyone who's not one of your household contacts. And you should stay at least 6 feet away from anyone else that you encounter while you're out walking or running or biking.
Have there been any examples of citations for businesses to this point?
Not yet.
So the question to District Attorney Steele was, have there been any examples of citations to businesses as of yet? And the answer was no.
You mentioned that there's 26 new cases here in Monco. Do you know how many of them are healthcare workers or first responders?
I don't have that information.
So that's not a statistic we've been keeping track of in Monco, is that right?
We keep track of it in terms of wanting to make sure that we do contact tracing if they do fall into one of those categories. I just don't have that number in front of me.
You also mentioned that you're broadening the criteria for who will get tested. Can you kind of explain why broaden it and why now is the right time to do that?
Well, we're broadening it because our site has been working extremely efficiently to get people through. As I said, we will have, by the end of today, tested approximately 1,100 people. And we had a backlog of individuals who were high priority for testing for a variety of reasons. We've pretty much now gotten all of them tested. So now we're going to that next cohort of people, which are people who are known to have had a direct exposure because they got a phone call back when we were doing contact tracing saying they were a direct exposure, or individuals that believe they, because of their doctor told them, need a test because their symptoms are consistent with having the disease. So we're trying to prioritize in this moment of scarce resources. We really have to prioritize who gets the tests. So we started with that most critical group, most of whom were in our critical workforce, and now we're going to the next cohort, which are people that are very likely to be positive. If it's possible that they can find out whether or not they're positive, that might help them reinforce staying home in quarantine or now in isolation if they know they're carriers. One of the most challenging things with this disease is that people can be carrying it but be without symptoms. So they can think they're okay and be out in the community but actually be spreading it. And so that is also part of why we're asking people to stay home and taking this more serious step to try to encourage people to stay home, because people could have it and not know it.
You mentioned that test kits are limited. It's been well documented, not just here, but everywhere. How are you getting them in, and is there any concern that you will run low to the point of having to close that Ambler campus, that drive-through site earlier than expected, since it has been going so well? Is there any concern about that?
So we, one of the great things about the site that we set up at Temple Ambler was that it is being supported with resources from outside of our area. So we didn't take any test kits or any personal protective equipment or any staff from any of our hospitals in order to set that site up. It's all coming in from the outside with support from Health and Human Services. So we were allotted a certain number of tests. I'm not exactly sure what the number was. It was in the 2,000 or 2,500 range. And we are hoping that we will get additional kits to do the testing, that being the swabs and then the viral media that the swabs go into. So we're very hopeful that we will continue to get more tests, but we have not been promised yet that we will.
So in 4 days, it's Friday, you've eaten through about a little less than half, I guess that would be about right.
That's about right.
So you're not sure when the next batch is coming?
That we have not been promised additional test kits.
So as far as
So
you know,
we'll work as long as we can. We've obviously put requests in for additional kits, and if we get them, we will stay open and keep running. The folks out there are doing a great job. The other thing that this is helping, though, is all of our hospitals. We have 9 active hospitals here in the county. by us taking these 1,100 people out of those hospital emergency rooms, we are reducing the pressure on them. We are helping to keep those hospital workers safe and those hospital environments safe from potentially being contaminated with the virus. So this is just one example of how we're working across our region together to fight this thing, with each of us doing what we can to help the whole.
What's the timing or backlog on test results at this point?
The question was, what's the timing or how long is it taking to get test results? So it really varies depending upon where you got your test done. We are hearing anecdotally from our hospitals that it can take anywhere from 4 to 6 days to get results back from commercial labs. We've been getting the tests back at our test site a little bit quicker than that, but it's a variable number. So there's really no set answer to that question. It really depends upon where you got your testing done.
So that kind of reinforces your point of if you're healthy with minor symptoms,
Exactly.
I mean, is there really a benefit to getting tested?
If you were at baseline a healthy person and you are at home with mild symptoms that you can manage, you just need to stay home, check in with your healthcare provider and let them know, but you should just stay home. You don't need to be tested. Because there's no specific treatment for this disease, knowing that you're positive, it might be nice to know, but it's not going to change anything that happens. If you have underlying medical conditions, if you're immunocompromised, if you're elderly, or if your symptoms seem a little more severe, you should absolutely call your healthcare provider and follow their directions. We do not want you to show up at the emergency room unannounced, and we do not want you to show up at your doctor's office unannounced. They need to take precautions to make sure that an entire area of an office or hospital isn't potentially contaminated. And then, if you're having symptoms that feel life-threatening, you should call 911. Our paramedics are ready and willing to come and get you.
Are you getting, or do you expect to get information on people recovering, people who were hospitalized and who are getting out?
We are still not getting any information on people that are recovering. So I don't know if, for instance, we do not get information if someone's been discharged from the hospital. That's just not part of the reporting.
In terms of medical supplies, like masks and things like that for these healthcare workers, do you know if any help in that way is kind of coming? If it's on the horizon, do we have any promises or know of anything that's coming down the pike so that they don't run out?
So let me reassure people on a couple of activities that are going on. So we are all in regular communication, and when I say we, I mean our Emergency Operations Center and myself and the other commissioners. We are in regular communication with our hospitals here in the county. And at our level, it's every several days, but at the level of the Emergency Operations Center, it's literally at least every day, sometimes more than that. Additionally, over this weekend, we had a number of phone calls with the 5-county area, with elected officials and others, and we are working on a regional dashboard that would help all of us stay up to speed with how everybody's doing across our southeast Pennsylvania, so that we can share supplies if needed, know where there's open beds, know what different counties' numbers look like, that sort of thing, because this really does require a regional response. It's why Governor Wolf's order for people to stay at home is the entire region. So in terms of specific locations, hospitals have a process, a very well-known process, where if they have an unmet need, like for personal protective equipment, they are to notify the hospital and healthcare system or Hospital and Healthcare Association of Pennsylvania. And if HAP cannot fill that need, then they come to the county and we work with them to get that need met. We have requested masks, in particular N95 masks, from the Strategic National Stockpile. A part of the number of masks that we requested has been approved, and that has been coming in pieces. It's kind of bit by bit. So as that comes in, we're working very closely with our hospitals to make sure that they're getting what they need and that we have here what we need for our first responders. It's been a very collaborative, very interactive process.
You mentioned collaborative. There's people that are taking this downtime off work and making their own masks and trying to donate them. What can you say about just people willing to pitch in? I know they're not N95 masks, but they say they're better than nothing for sure. What are your thoughts on that?
So we've just been overwhelmed with the generosity of the people in our community in every way you can imagine, from food, to volunteering to deliver Meals on Wheels, to making masks, to all sorts of things. So I'll share with you, I'm an anesthesiologist, so when I worked clinically, I worked in the operating room. And prior to 1980, now I was not an anesthesiologist then, but prior to 1980, people used cloth masks in the operating room. If you ever watched MASH, the television show, you might notice they were wearing cloth masks then. That was the standard of care. And then in the early 1980s, the masks that we use today became widely available, and the standard switched to that. So in the operating room, it's not anyone's first choice, but it would absolutely be better than nothing to have a cloth mask. What the homemade masks aren't are the N95 masks that would actually prevent someone from breathing in the virus. So they would not be useful for contact with an individual who is a known positive, but to save other masks, they could be useful and could have a role. So we're here at the Emergency Operations Center working on getting some specifications for what those kinds of masks could look like and what would be most helpful. But the message is we're so grateful for anyone that's trying to help, and we really appreciate that.
Is there any information, there was a death over the weekend, any information on underlying health issues or any other update on that?
So there was a death, very, very sadly, here in Montgomery County over the weekend. It was a gentleman, 72 years old, from Abington Township. And all I can share with you is that he was positive for COVID-19 and had been hospitalized for a couple of days before his demise. But I just think that, and again, we want to extend our heartfelt condolences to his loved ones, to his friends, to his family. And this should be a reminder for all of us how urgent it is to stay at home. That the way that we beat this thing is by staying at home and making sure that we're not exposing anyone who's at particular risk if they get this disease, and just keeping that spread down. All right. Just logistically, so everyone knows, we're going to start posting on our hub website, our montcopa.org/COVID-19. Every day we will post the time of this press briefing. We try to do it most days at 3. Sometimes there's other intervening events that, because of other people's press conferences or other announcements, that causes us to push it a little bit later, like we did today. But we will start putting that up on that website every day so that everybody knows. And we will obviously continue to send out the press advisories. As of now, we believe tomorrow we will be at 3. All right, thank you, everybody.